Good evening and a warm welcome to all the dignitaries present here. I'm Srevshi from Clanet, serving as the allocated session assistant to ensure a seamless experience. Clanet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clanet serves as the digital partner for this event, hosted by the Indian Medical Association Medical Students Network, Karnataka. And the focus of today's session is Building Base in MBBS, a webinar by Amrit Nasta. So let's begin today's session, for which I would like to invite Dr. Vedika Burma ma'am to take over. Over to Dr. Vedika ma'am.
I'm just a presenter, not a doctor. So, good evening to one and all present here for webinar by Dr. Amrit Nasta for building base in MBBS. Dr. Amrit Nasta, who has 8 years of experience in teaching MBBS students for theory, practical, and entrance exam, will enlighten us with his webinar, especially for batch 2021 and 2022 students, focusing on how to prepare for major subjects for final year and beyond. I, Vedika Verma, the core member of IMA-MS in Karnataka. It's an immense honor for me to welcome you all for the today's session. I would like to welcome Dr. V.V. Chinevas, sir, President IMA-KSB, Dr. Suri Raju V, sir, Honorable Secretary, IMA-KSB, Dr. Padma Prakash, the Chairman of IMA-MS in Karnataka, Dr. Vinay Srinivasa, IMA-KSB Coordinator and IMA-MS in Subcommittee. I would also like to welcome Swapnil Sinha, who would be the moderator of today's event. For any inquiry, you can DM him or mention in the chat box for the questions. Now, I would like to request Dr. Amrit sir to enlighten us with his knowledge for today's webinar. Thank you.
Thank you, Vedika, and thank you to Team IMA. I'll get started. Just confirm that you are able to see my presentation. You can see the first slide.
Yes, sir.
Okay. So I will first speak briefly about what needs to be done or how you can make your life more manageable if you are an MBBS student, because over the years, a lot of seniors will give you a lot of different advices and you don't know whom to follow, what to believe. So I will tell you from my almost 10 years of teaching experience what needs to be done. And I've seen so many changes happening over the last maybe 4 or 5 years in the curriculum, in the entrances. Definitely some tweaks need to be made, and a very new thing has happened on the current third minor and final year batch, that their entire program has changed. So what they are having in third minor and final year has become totally different. So what mistakes you will make, what problems you will face, how to build your base, that is the main aim of today's discussion. And at the end of it, you can of course ask me questions, no problem, and take full advantage of this session, right? So first I'll tell you, I'm guessing many of you would be in different stages of your life, but most would be in either third minor or final year. And you must be having some aim in mind. And I'll also tell you how your journey must have begun and where it is now and where it is headed. So when we enter MBBS first year, second year, it all goes very fast. By the time we come to grips with it, anat physio biochem is already done. Second year, we understand a little bit pathopharmac micro. We start studying seriously. And then in third minor, you have only two subjects now. At least currently, you are having only forensic and PSM. So then you will become active in college fests and those kind of extracurriculars. So by the time you will reach final year, you may have wasted a lot of time. I should not say waste, but you may not have correctly utilized your time. And when all the subjects come together in final year, it becomes very burdening. Till last year, your seniors had only four subjects, which was also a lot. You have the added part, you also have two more subjects. So, what should be done if you are in third year or final year? What should be your mentality? Because at the end of the day, when you will become an intern or a post intern, you will have some future prospect like a entrance like NEET PG, or you may be thinking of USMLE or PLAB. So there are a lot of different avenues, but at the end of the day, what you will study in MBBS is what will take you there. Like, how do I get a good rank? Is it all that I need to do is study MCQs and internship? Of course not. So these 3-4 years of MBBS are important, and I want you to understand how to make the most of it, especially if you're in third year or final year, because this is the time which you don't realize how valuable it is, and when you reach internship, it's a little too late to make too many changes. So first understand what is final MBBS going to have, because till now whatever university exams you were giving were all very okay, let's just get done with them, I just want to pass. That is a typical mentality because your aim is something else, and that's what our seniors also tell us. But let's be clear, now things are a little tough. Passing is also not very easy. So in final MBBS as of today, you are going to have theory papers of not 4 but 6 subjects. In most of the universities in India, it is now 6 subjects. Till last year, it was 4. I'll show you which they are. You will have 6 practicals. And each practical has a lot of small subjects also. Like in surgery, you'll have orthopedics also. And of course, you are at the end building base for what? For some entrance or post graduation or something that will take you further. So you have to keep all this in mind when you are preparing. When you study for uni exams, you only think, okay, I have to write question answers. I just want to pass. And in between, there will be some news of, okay, next exam is coming, next one, next two, and then it comes and then it never really happens. So we don't know if you will have a university exam, but at least currently you will think of it university exam as theory and practicals. And you will think theory, I just want to pass. So what most of the people do, either they take some subscription and they are like, let us finish the videos, watching the videos of the big subjects. That means I have prepared myself in theory. Or they take seniors notes or ready-made notes. Forget reading textbook, but you just want to get done with it. Practicals, you go for college posting, but you don't really utilize it. You know, like you are running behind residents to take some lecture, some clinic, something. But a lot of time gets wasted and then you give up. Then all you want to do is sit in the library and watch videos. And you're like, practicals, I will just in the end take cases from the resident if I get, or I'll just read the pro forma and go. This may have worked till 2-3 years ago, but in today's time, it's not going to work because exams have become harder across all universities. So I'm in Mumbai. Maharashtra University exams have definitely become harder. It will be the same across everywhere. Now, where you are and what your mindset should be at this point of time. Most of the universities, now, if you're in third minor, you should look at this as this is where you will be next year. If you are in final year, you will be on this timeline as of now. And most universities may have increased the final year duration a little bit. So instead of having university in Jan, Feb, maybe it will be in March, April. Okay, let's assume for the positive side, it's not going to be later than April, definitely not. You are now in March, kind of in the middle. So you have only this much time, like April, May, June, July, August, September, October, November, about 8 months, which is not a lot of time because suddenly in December, Jan, your prelims will come depending on which college and university you are in. And in 8 months' time, you'll realize, oh my God, how much have I really studied? Because you are going to have to do so many subjects. And the moment prelims are over, some people will have a little bit of 1 month or so of preparatory leave, and then it's university. So final year will get done very fast before you know it. And the amount of things to be done is also a lot compared to how it was before. So this is one very important couple of slides that you need to look at because this is to give you perspective that what needs to be done and what your final MBBS covers or what it entails. All this is a part. Like we always think, okay, I have medicine, surgery, ob speeds, but it's isn't just medicine. It's not just medicine. Medicine also has dermatology, psychiatry, which are entirely different subjects, but they are a part of medicine. It'll have pulmonary medicine, which is also quite different, genetics, nutrition, all small systems. And when we think of medicine, we only think of cardiology, neurology, rheumatology, nephrology. But there are so many smaller parts which we are going to neglect. And unfortunately, they are also going to feature in whichever entrance you are going to give. Right? When we think of surgery, we think of GIT, urology, hepatobiliary. We never think of surgery will also have orthopedics. It's a big chunk. Anesthesia, radiology. I don't want to scare you, but head and neck surgery, dentistry, all this is a part. Whichever previous year papers you will open across the boards, these kind of subjects will feature. You will get questions from radiology, dentistry, in whichever university you are appearing for. These are just two subjects. Then you have full OB, full gynae, pediatrics, and now in most universities you have ENT opthal. Let me tell you, even without ENT opthal, it was still a lot to do. With ENT opthal, it becomes even more burdening. So you need to be clear that these are the things that you need to do. And this is your timeline, like realistically 8 months approximately till your prelims. 8 months is not a long time because in between you will have university terminal exams, post-ending exams, sessional exams, your birthday parties, college fest. So many things will be there. So how much time are you really going to study? So my main aim for you is to be aware that this is what needs to be done. Now, how do you go about it? I'll help you a little bit with, but first accept that you need to do this much, whether you're in third minor or whether you are in final year right now. If you are in final year, then itna to you have to do. And if you are in third minor, some chunk of this you should try to get done in third minor itself. At least some chunk. This is a format of how a theory paper comes in most universities in Maharashtra. Okay, so I am Maharashtra University, but this is as per National Medical Commission guidelines. So most of the universities will have a similar paper setup where a surgery paper one of 100 marks will have 20 marks MCQs, and they have specified everything like there should be clinical MCQs. All this is mentioned. You will have long question, short question, long question, short question. You'll have questions on something called as ETCOM. I hope you know what is ETCOM, attitude, ethics, communication skills. So a paper will look like this. In surgery, paper one in most universities will have general surgery, GIT, and hepatobiliary systems. Big chunk. Okay, don't think this is less to study. Big chunk. This is just paper one. Surgery paper two will have a similar distribution. Okay, this may vary from university to university, but I'm just giving you a rough idea of how it is going to be. Where paper two will also have general surgery, urology, super specialties, anesthesia. This is what I was telling you. Two questions will come from anesthesia, two from radiology, dentistry. All this will come, and orthopedics. So when you are studying, keep this at the back of your mind that surgery as a subject is not just general surgery, urology, and GIT. It has these small other things also which have to be incorporated. And only if this is there at the back of your mind when you will study, you will actually do things systematically. That's what I want you to establish. This is Maharashtra University practical pattern. Similar is there in most universities, where in surgery you'll have a long case with communication skills getting a dedicated score, short case, ortho short case, table viva, OSCE, all this. So even for practicals, take things a little seriously. The first thing you need to accept is just going for postings for the heck of it is not going to solve your problem. You need to do things a little seriously because, yes, I know many of you would just want to pass because, okay, my aim is something else. But passing also is going to become strict. I have seen over the last 3 years in Maharashtra colleges, the passing percentages has been not so good, even in the government institutes. Like there has been 10 to 20% students failing, which was never the case 3, 4 years ago, till the CBME pattern came. Now this has gone one step ahead. This is CBME pattern with two more subjects in final year, two more exams. So take things a little seriously that this is how surgery practicals are going to be. Now, how do you exactly study? Like I'm saying, build a base which will help you pass the exam, a base which will help you in the long run, like entrances or USMLE. So, what you need to figure and how you need to begin. First, you need to decide your sources. There are many sources. I will show you the pros and cons of each. You can choose whichever suits you. Like if you are someone who does not read textbooks, that's fine. If you are someone who wants to read ready-made notes, that's fine. But everything has some good things, some bad, some problems. So First, you need to decide the sources. One thing you need to keep in mind, for one subject, you cannot have 10 sources. Okay, because some topic is given well in this book, and then something I got from my senior, and this and that. You can't just cherry pick and put everything together. It will become very messy. You should keep limited sources. So if I have to study surgery, and if I'm someone who reads textbooks, but I don't want to read Bailey, it's okay if I read SRB or Manipal or whichever books fits the bill. But don't do some things from here, then something from some app note, then something from seniors notes, because revising it becomes difficult. This second point, the most important point, you need to create a schedule or a timeline. If you are in final MBBS, I told you 8-9 months to your prelims. So you need to divide your time where you need to have a rough schedule that I have so many subjects. Each subject has sub subjects. How do I break them up? Like a recommended thing to do would be to do one big subject and one small subject. So big subject is surgery, small subject would be pediatrics or ENT. Medicine, pediatrics, OBGY, ophthalmology. So you can combine them like this and spread them over 2 to 2.5 months. Instead of doing one subject at a go, you can make them overlap with your posting if you go for clinical postings. So first you need to get an idea that okay, in 8.5 months, if I have to do surgery and ENT first, I have 2.5 months to do it max, which means I can dedicate to surgery in maybe 50-55 days and to ENT maybe 20-25 days max. So how much matter can I study in that much time? Then all your calculations and misconceptions will go out of the window. Then you will be like, okay, I can only do this much. Then that idea of completing 80-90 hours of videos will again go out of the window, because then you will know I have these many days and this is the max I can study. When you study for university, you have to study topics which you can write an answer from or from which you can solve the MCQ. The preparation is not very different from entrance, but you need to have some way to write an answer, because theory is about writing, it's about presentation. So when you study a topic, you should know which of these points will feature in your answer if a question comes on that topic versus just studying the topic, just for the heck of completion. In big subjects, you cannot do it cover to cover. Okay, let's get real. Even if you are in third minor, I would not recommend doing any subject from cover to cover, but the IMP topics should be picked up first. And then if you have the appetite and the commitment, you can do more. There is no end to how much you can do. So you have to gauge your level, that if I am someone who wants to do 50-60% of the subject, it's fine. But if I am more ambitious, I can do 70-80%. There is no 100% in this, which could be applicable to first year, second year subjects. Don't just go about memorizing, because if you are building base, some concepts have to be built. MBBS is the time to build concepts. I teach a lot of students who are preparing for entrances, and the biggest problem that they face in surgery, especially, is they are interns or post interns with zero concepts. So I have to teach them surgery from the start, like I would be teaching an MBBS student. So you are an MBBS student now. So now you have the time. It's not a lot of time, but there is still time to learn concepts. How you learn is up to you, depending on the source which you feel is most appropriate. Whichever you can sync with. It can be textbook, it can be app, it can be anything, but it has to have some concepts. So you can't come for an entrance preparation and then I have to teach you hernia and I tell you, oh, hernia means there should be a defect and there should be a sac, which is the current state of most of the interns and post interns. They don't know these kind of basic things. So how are you expected to solve any MCQ where it will be of a certain level or a certain caliber? So spend some time based on your ambitions to build concepts. Otherwise, in entrance, nothing, you will not get any question correct, which is conceptual. Then it will just be out. Clinical cases, when you go for your postings, if you have good units, you should take advantage. But if you don't have good units, then the very least that you should do is at least practice the case taking. That's not very hard. No, you can practice the case taking. There are patients in the hospital, even if he does not have a real disease, but he has some other disease, you can do abdominal exam, respiratory exam, just for practice. Take the history, take the exam. If you are a non-local, if you don't know the native language, then this way you will be able to get an idea. of what are the common terminologies. Like if you are studying in Maharashtra, but you're not Maharashtrian, you don't know the Marathi language, patients in the exam are going to speak in Marathi. So you need to know some words to get your way around. That cannot happen by sitting in the library and just reading books or watching videos. And please don't ignore table viva, means OSCE, instruments in surgery, X-rays in surgery and medicine, ECG. Don't ignore them, because if you are having bad practicals, these kind of things can rescue you. Okay, because they are easy scoring things, and if you have a bad long case, bad short case, a table viva can rescue you. These are the available sources to study. All have good and bad qualities, and there is no ideal source. Whatever source works for you is fine. Okay. If you ask me as an MBBS student, what I would recommend, of course, is going to be standard textbook. So I would say Bailey for surgery, Davidson or Harrison for medicine. Of course, you should try, but let's get real. If you have not done it ever, then even in final MBBS, you're not going to do too much from a standard book because you don't have so much time. So at least IMP topics can be done from standard books, and the other peripheral topics you can do from whichever small books are available. If you are a textbook person, if you are an app video person, frankly, app videos are too much, even though they seem 80 hours, 90 hours, 100 hours. They have too much of information and they are focused mainly on MCQs. So if you are choosing app videos, at least use the ones where you are actually learning, which will help you in your exams, at least in your university exams to some extent. App notes by itself you cannot use. I would strongly recommend against. You can't just open some app notes and try and expect to understand the topic. It's not going to happen. You will not be able to write answers in theory. MCQs, maybe some you will get right, but otherwise it will be all like mugging it up. And seniors notes, stay away from, because your seniors are not doctors. उससे better would be to use app notes, but don't use seniors notes, because they may help you for some basic things, but for most of the things, they are going to be very unreliable. Okay, so option one or option two with the corresponding notes would be a good way to go about it. Now, what mistakes are you going to make? What solutions can you opt for? Can I just read IMPs from previous years for big subjects? You can do that. At least if you do the IMPs, your odds become very good. And let me tell you, the IMPs only are the questions which are asked in entrances. So don't feel what about the rest. The rest you can top up when you do your internship. But at least for your MBBS exams, IMPs are the very least you should do. If you are a good student, of course, you will do more. But if you want to just clear, at least the IMPs for medicine search OBG is acceptable. It's not ideal, but it is acceptable. MCQ preparation should be a small part of your studying in university. Everybody, all your seniors will tell you, no, 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 start solving Q banks, Q banks, Q banks. You need to give 10-20% of your preparation for MCQs. It cannot be 80-90%. It's good to get an idea, it's good to start solving, but it should not take precedence over practicals or theory or lectures. So MCQ preparation, you can always do a lot more in your internship once your university burden is done. Or if by chance they change the exam pattern and they say maybe you'll have a next exam, but I don't foresee that happening immediately. Live class or recordings is up to you. Live classes, I personally find much more interactive and much more easier to grasp because you can ask directly. Recordings are one way. So nobody really watches recordings with their heart. They are doing it out of compulsion. Please use your postings when you go for cases. I already told you, even if it's not an actual case like a lump in abdomen, but person has some abdominal problem, you can still take history, perform abdominal exam. So you know in the actual exam, if a patient comes, what to be done. And in surgery, ENT, opthal, at least the basic procedures you should see. Okay, like in surgery, I would say the minority procedures like lipoma excision, fibroadenoma excision, neck node excision, they are good procedures, hernia hydrocele, which you should see because you will understand. Don't run behind fancy surgeries, Whipple surgery and pancreatic surgeries and all. Not needed. At least not till you have gone through the basic surgeries. Okay, because it all seems very fancy. Wow, proximal sphenoidal shunt happened today, or laparoscopic supra major surgery happened. It's all nice to hear about, but not at your level till you have gone through the basis. Don't make these mistakes. I am telling you now only. You will regret it if you don't listen to what I'm saying. The first one, don't don't study randomly. Make a schedule. 2.5 months for surgery plus ENT, or 2.5 months for medicine plus pediatrics is not a long time. Don't run behind every damn topic because it may come in your entrance, because in entrance it will be a mix of all topics. It's not going to be high funda topics alone. It will be a mix. If you don't get the easy questions right, what's the point of getting tough questions right? Too many sources. Absolutely no. Few sources, limited content to be done repeatedly. How much you can study is your appetite, but it should not be from 10 places. It will drive you crazy. Completing videos does not mean you know the topic. Okay, because if I also watch a video in surgery, which I have been doing for, I don't know, 15 years, I have been doing only surgery. Still, if I watch a video and you ask me something from the video 2 days later, I may miss out on some things. So how will you remember everything? It's not humanly possible. So completing the video does not mean you know the topic. It's just a tick mark. It's just a green tick. It does not mean anything. Focus on preparing to write answers, because even though we feel how important it is, if the paper comes tough, some theory paper will be very tough. And if it's very tough, you don't want it to come in the way of you clearing and entering your internship and having a 6 months of back. You don't want that. So it should not be that you completely ignore theory and only study MCQ, 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 and then a tough paper comes and you are stuck. And papers are going to be tough because they are CBME pattern. Running behind clinics, only people who are helping you in some way, it's worth running behind them. Otherwise, if they are not teaching you, you can learn by yourself because patients are there. And you must know your university paper pattern for all the subjects. Because it should not be, oh, I never knew that dentistry and anesthesia questions come in surgery. They come. So you not knowing, but it is there in the university prospectus, is unfortunately going to be something falling short on your end. You don't want that to happen, right? So the biggest mistake, you don't seek help. You feel exams will get managed, and by the time you realize you are requiring help, it's too late. So please don't do that. The efforts that you will take in third year or final year, the base that you build now is what will help you clear any entrance. The last 2 year subjects are the most important subjects. You do them well now, in internship, you won't have to spend time on them. You'll just have to solve questions and then you will be ready for any entrance. Okay. So those are my 2 bits of advice. Now I hand it back to Vedika. You can take over. And if there are any questions, you can always ask me. I'll be happy to help you.
So if anybody is having any questions, kindly write in the chat box, so can respond.
Want any help, you can let me know. I'll also share this is my Telegram and Instagram page. I also conduct courses for undergraduates, for MBBS students. If you wish to take my help, of course, you can ask me. Next exam confirmation, we don't know. It's not out yet. And even if it comes out, we won't know. Because 2 years back, there was a circular where in June they said you will have next. They were even going to hold a mock exam. I'm talking about 2 years back. And they took money for the mock exam, and then just couple of days before the mock exam, they said, okay, next is not going to happen for you guys. So 2 years back, that's how things just, drastically changed over a matter of weeks. And in between, students were panicking. Like, how do you study so many subjects suddenly? Because all these announcements were happening in May and June. So till it doesn't happen, you can't be sure. The only thing you can be sure of is you are going to have university practicals and some university exam. How do we schedule our revisions? So that's what I'm saying. You have to first schedule your first study. And when you're going to do your first studying, your first preparation, the first time you study anything, you mark out things such that you know what you are going to revise. So the aim of the first time you study is to prepare for a revision. Preparing for OSCE is same as preparing for theory and practicals because questions in OSCE come from theory and practicals only. It's not any different. How to revise? First, how to study. If you are studying surgery and if you are using any particular source, first define what topics you are going to study. Like, there is not so much time, so you need to decide what topics you are going to study. Like, if I have to study esophagus, I know I need to study in esophagus achalasia, C esophagus, GRD. Like this, there are 3-4 topics. So first I decide that. Then I decide the source. Okay, I'm going to read SRB. When I study those topics, I mark out what I'm going to revise because when I will revise, I will have much less time. So I cannot do the whole SRP again. So every time you study something, the aim should be what will I revise later from that topic, and only those points should be marked. Only those MCQs should be bookmarked. I am not one who makes notes for any topic. I am one who would say use whatever existing notes or books are there and mark out what you want to revise. Whether you want to mark out what you're going to write in the answer or what you're going to study if it comes as an MCQ. That is called smart studying, no? Otherwise, you are studying randomly. How to connect topics which are common in multiple subjects like TB and PSM, pharma, micro medicine. No, 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 no. If you are in final year, then you study TB from medicine. Automatically, pharma micro comes in it. Okay. So stick to the bigger subject for that topic as you are progressing through the years. It will make more sense. Yeah.
Thank you, sir, for your enlightening session. My name is Swapnil and I'm the moderator here. So I
Yes.
think everyone's doubt is clear. Except there's one more doubt.
Yeah. Swapnil, you want to moderate?
Yes, sir.
Yeah, tell me.
Yes, sir. Yes, sir. Yeah. So, sir, Tanisha Sharma is asked, sir, shall we study final year subjects on the same day we have clinical postings?
That is your choice because how many postings are you really going to attend? And are all of those going to feature in final year? Ideally, yes, you should try to overlap it. But see, in postings, if you are having surgery posting for 1.5 or 2 months, the exposure will only be of 20-30% of the actual syllabus. The remaining 70% syllabus you'll have to do from the books only. So you can overlap it. But don't expect that in every surgery posting day, I will see a hernia, the next day I will see an jaundice, the next day I will see a malignancy. It's not going to be like that. You will see the same kind of cases repeatedly. At least those you can do well, but the rest of the subject also has to be done. Yes. Any other question? I hope I took your doubts and I hope I didn't scare you. If you feel scared, it's good to be scared now if you are in MBBS. Because if you are scared now, you will take corrective action. And if you are in internship, then there is no point being scared. Then it's too late. The ship has already sailed.
Thank you, sir, for your enlightening session. It gives us very much strategy to prepare for our final years. So I would like to give the vote of thanks to Vedika.
Once again, thank you so much, sir, for providing us with your wonderful knowledge that will definitely implement in our final year. Thank you to all the members who have joined and uh, all the office bearers who are present here. Thank you so much.
Thank you, guys. If you need any help, feel free to connect with me. Always there to help you guys. Take care. Bye bye.
Thank you so much, sir.
Thank you so much, everyone, for giving us the opportunity to host the session. Good night to all of you.